Go.
Hi, my name's Chad, and I'm from the 2015 Hartnell VN class, and I'm here to demonstrate medication administration. It's PO medication administration. We're going to be pulling a few meds here from the med cart. What you want to do first is verify the physician's order against the MAR. So I have the MAR here, I have the physician's order, and I'm just going to go down through and do my 5 checks. So the first thing that I'm going to do is verify the patient's name. This is Mr. Roger Vilano. Date of birth is going to be on there. Again, going between the physician's order and the MAR. I'm going to check the medication, that it's the correct medication, that it's the correct dose, it's the correct route, and it's the correct time. And right now we'll say it's right around 8:45 in the morning, right at the start of your shift. It's scheduled for 9 o'clock. All the meds that we're pulling right now are scheduled for 9 o'clock. So done that. That's my first check. The first medication is going to be potassium chloride elixir. So I know that that's a liquid. By the way, you have your keys with you. Just always remember to whenever you have to leave your cart, that you're locking it and that you know where your keys are. So again, this is a liquid medication. I'm verifying that this is potassium chloride. That's what it says on the MAR. It looks like I'm going to have to do some math here. The order is for 10 milliequivalents, and the concentration here is 40 milliequivalents per 15 ml. So if you do the math, so it's 15.75, so it should be 3.75 milliliters. And if you do the math, you will end up with 3.75 milliliters of this elixir into one of these medication cups, okay? And you'll end up with 10 milliequivalents, okay? When you're pouring a solution or liquid, you always want to make sure, first of all, obviously you're going to check the expiration date, and this is still good. It says December of 2015, and then you're going to make sure, obviously, that the patient's name is on there. When you're opening it, you want to have your hand on the label as you're opening it and pouring it, and you want to have the medication cup on a flat surface, so that you know that you're level when you're pouring, and you're getting an accurate dose. So most of these medication cups you're probably not going to be able to get 3.75, but I'm just showing you what happens most of the time when you're pouring. That's how to do it, but the way to do it is they'll have these covers on that you can put on the bottle, and it'll have a little hole in the middle, and to go along with that, there's a little syringe that you can use to kind of insert into the bottle, kind of like the same way that you would as if you're drawing something for an injection or administration. And your instructor would most likely have something ready for you so that you can understand how that works better. But as of right now, I'm just going to sort of show you that the main thing to remember is when you're pouring liquid into a medication cup, you always want to have your hand on the label and flat surface for the medication cup, and then after you pour, actually before you close it back up, you're wiping that spout so it doesn't have like that buildup there. Put this medication back, and then set this aside. That's a ready medication. You're going to put that on the tray. By the way, as you're checking the MAR when you're checking it first against the physician's order, you're going to date it, and at the very bottom you're going to sign it. And then you're gonna come back after you administer it to initial all of the medications that the patient had received. So I'm doing that right now. Nurse's signature. Okay. So that's the potassium chloride. So the next medication going down is digoxin, 0.25 milligrams PO daily. And the additional instruction is to hold for an apical pulse below 60. And in the scenario here, which you will have with you, the patient, which I've just checked, so I would have pre-checked that already, would have listened to the apical pulse for 1 full minute, and the apical pulse was 64, so we're good. So we can give the digoxin, and again, 9 o'clock is the scheduled time. We're within that time. There's a 1 hour window before and after. This is going to be a pill. So, a common brand name for digoxin is Lanoxin. I'm going to take out 1. And this says, again, you want to verify that the expiration date hasn't passed. This says 0.25 milligram per tablet, so this is perfect. I'm going to pop this out of, open it. And I'm actually going to leave it up there. So going down, I see furosemide, Lasix, 40 milligrams PO daily, again, 9 o'clock. So, go to the Lasix bin here. This is 40 milligrams per tab. Next one down is metformin, 500 milligrams PO BID, 2 times a day with meals. And again, obviously with meals, you want to just make sure that either the meal tray is on the floor or right there, right as you walk in. 500 milligrams. So metformin. Okay. Expiration date, 500 milligrams per tab. And that's it. You just want to make sure that when you're going through your MAR that you're not missing any other medications that are due on that same time. Is really important. So again, I'm going to do another check. I'm going to make sure that I'm administering medications to the right patient. I have the right drugs here, and I did that individually as I go. The right doses and the right time, the right route, everything PO, and the right time. Also, one thing that you want to pay attention to is you're looking to see what allergies the patient has before you go in, and you're going to re-verify that when you go in. So I have all of my medications here ready on the tray. I'm going to close my med card. Excuse me. Close that, make sure it's locked. I know where the keys are. Now I am ready to go into the patient's room. Okay. With my tray. I'm gonna come in, I'm gonna knock. Mr. Failano? Hi, good morning. My name's Chad. I'm gonna be the nurse today. I'm here to give you your morning medications, okay? You're gonna do hand hygiene. And you're going to verify the patient. Mr. Failano, could you do me a favor and just repeat the your last name for me and your date of birth? I'm checking his armband, and he's able to verify. There's more likely going to be a band to alert you for any allergies. You're going to check that as well. Obviously, right now the patient is in a supine position. You want to get the head of the bed up and inform him of what you're doing. We're going to sit you up a little bit so you can take your medications, okay? And then you might want to ask him how he usually takes the medications, you know, if he prefers orange juice or just water, or if he takes it with applesauce. And then you want to take time to do like a visual assessment and ask him, you know, a few questions like, are you in pain? How was your sleep last night and all that? Okay, so you want to make it a habit to know your meds and know why you're giving the meds to the particular patient that you're administering them to. So, you know, sometimes they're going to ask you too, so you want to be ready with that. And if you need to go in there with a list, just to remind yourself which meds are which, then do that. But it's always helpful to know. The potassium chloride, you know, you're going to tell them that this is something it's a supplement, really. It's probably being given because he is prescribed also the furosemide, which is a loop diuretic, which helps to get rid of potassium. So the potassium is probably more likely ordered to replenish his that electrolyte deficiency. With the digoxin, that's a digitalis medication that's going to help with your cardiac output, and it's usually prescribed for patients who have congestive heart failure. It's going to help. Just getting the heart working better. And then with metformin, that's an anti-diabetic medication. So obviously, you know, should know that this patient has a history of diabetes. So that's just knowing your meds. So when you're giving the medications, you give this to them, or sometimes they'll need help, you know, putting the actual pills in their mouth. And then you want to stand there and make sure that they're actually taking the pills. Water right after. You want to just observe that they're, you know, that they can swallow okay, and they're not having a difficult time with that. And this is the liquid. And then water with that. All right, so I've done that. Probably going to leave them up a little bit. If you took extra water there, or it's probably time for his breakfast. I'm going to ask him if he needs anything else that I can help him with while I'm in here. I'm going to make sure that the call light is within reach. I'm going to lower the bed to the lowest possible height. And I'm also, because, again, this is just knowing your medications, because I would administer furosemide, the Lasix, he's, you know, you want to watch out for him, you know, having to void. So because of that, you want to either make sure that the urinal is nearby, if that's sort of the setup, or make sure that if he has mobility issues, that, you know, someone's going to be ready to assist him to go into the bathroom. That's it. And then you wanna just, again, make sure that call light is within reach, and go back to your MAR, and you want to document everything.